Okay, moms, do you ever sing this song with your kids? Get it? Heads, shoulders, knees and toes, knees and toes. All the while, you might be feeling like, boy, I'd like to redo everything between my head and my toes, right? Well, medicine has come a long way, and Dr. Thomas Kotoske is here to show you how he can renew your look from head to toe. And we're talking about a mommy makeover. And Dr. K, what woman doesn't want a mommy makeover?
I don't know one. I really do not know one.
I'm sure you've met them all, right?
Yes, I've met a lot of women for
What
sure.
does that really mean? When you say mommy makeover, what are you referring to?
It's rejuvenation. It's basically looking at a woman and restoring what they may have lost through pregnancy or just life.
Or
you know,
time.
I think with time,
Right,
exactly.
right. Okay, so you do a myriad of procedures on women. Just kind of give me, I know you can't do them all for me right now, but kind of give me a run through of a procedures a mommy makeover would consist of.
It starts from the head to the toe.
Okay.
We do things on the face where it could be something as minimal as a facial filler or Botox, a lip enhancement, to the quick lift, which is a minimally invasive facelift. Sometimes it's a rhinoplasty, which is correction of the nasal architecture if they've had issues throughout their lives.
Matter of fact, let's take a look. I have a before and after of one of your clients who've come into you. Amazing, amazing. So what are some of the procedures you did to her?
Well, I mean, she's had a few different things done. We corrected her nose to give a little more refinement to that area. We've done some things to her eyes. It's called a blepharoplasty, where we remove skin, fatty tissue. And I've done the minimally invasive quick lift on her as well to restore more architecture to her jawline and her cheeks and so forth.
All right, well, let's move on down the body then. We're going down all the way to the toes here. So now we're talking about breast augmentation, which, for many women, they lose so much of their breast elasticity just through pregnancy or breastfeeding. And she looks amazing. And you know what I love about this, Dr. K, is that it's not overdone. The after is not overdone. How do you decide what's perfect?
It's really interesting. When patients come into the office, we have a very thorough evaluation of them. And what we're doing is we listen to them. We're trying to achieve what they're looking for. I try to keep things very proportionate when I do a breast enhancement surgery. We take a lot of factors into consideration: their age, children,
whether or not they're going to get pregnant again,
if they're going to get pregnant again, and so forth. But my goal is to keep something that is very, very proportionate, symmetrical, just a nice flow with the body and restoration. Excuse me.
Good for you. So you actually listen to your patients.
I do. I do.
I like
exactly.
that. All right, we're moving on down now. We're to tummy tuck. Now, this is pretty amazing because this is just like, to me, I see that not as weight, but it's just skin. That, for some women, it doesn't matter what you do after pregnancy, it's not going away until you get rid of it, literally.
Well, that's true. And, you have to evaluate the patient. It can sometimes be nothing more than liposuction, where you're removing the fat cells underneath the skin. But if you have too much laxity and extra skin, we remove it via a tummy tuck. Sometimes it's done in combination therapy with breast augmentation, with some facial enhancements. So we do a lot of different combination treatments for patients.
All right, and we're moving on down. We're not actually heading on to the toes here, but almost. And this before and after picture, I have to tell you, is unbelievable. What procedure did you do?
That is strictly a liposuction procedure, and this is what I'm saying. Some women will come in and they've had problems their whole life, that they've been trying to deal with this, and this is more genetically predisposed. But we staged this procedure. We did 3 different liposuctions to achieve where she's at today.
All at the same time, or
no? We spaced them out, usually 3 months apart. We had them on appropriate diet and weight control. Most of our patients will do that in conjunction with it, and then we're able to get her to where she wants to be.
And I think the big question when you're a mom, time is limited. Can you do all these procedures at the same time?
Well, we practice safe medicine, and we do an appropriate workup on every patient that rolls through the office, or comes through the office, excuse me. But the key is safety first. I don't like patients on the table, the operative table, for too long of a period of time, so that's the key factor. And health risks are the major element that we look at, whether it's cardiac, neurological, what have you. So.
All right, good stuff. Good information, and who doesn't want to be a hot mom, right? Okay, Dr. Kotoske, along with the Cosmetic Surgery Institute, has a special offer for you. You'll get $100 off any surgical procedure, plus 10% off any Body by Kotoske spa treatment or product, because he offers a whole ton of other services there at his office. 623-516-2633. 2639 is the phone number to call. Mention Sonoran Living for that special offer. And actually, Dr. Kotoske has complimentary consultations every Tuesday and Thursday between 10:30 and 3 o'clock. So you know what? Find out if this mommy makeover is right for you. 623-516-2639, bodybykotoske.com.